Let us now go to face reading. The topic is pulmonary emphysema. Pulmonary emphysema refers to a pathological condition in which the distal end of the bronchioles, including respiratory bronchioles, alveolar ducts, alveolar sacs, and alveoli, are enlarged and accompanied by destructive changes in the cavity wall. Common symptoms are fullness of the chest, oppression in the chest as if it is blocked, coughing and panting, copious sputum, irritability, palpitations, and other similar symptoms. The condition is characterized by panting, coughing, phlegm, and distension, and is mostly seen in the elderly, who often experience the onset triggered by external factors, though cold is the main culprit. Overexertion, anger, and blistering heat can also be triggers. Smoking, infection, and air pollution are also potential contributors to the onset of pulmonary emphysema. Face reading. Dark purple tongue texture, greasy or turbid coating. The symptoms are coughing, copious foamy white sputum, wheezing, panting, difficulty lying flat, and chest fullness and compression. Here we can see in this picture the dark purple tongue texture with greasy or turbid coating. For therapeutic methods, patients with pulmonary emphysema should quit smoking and keep warm to avoid catching colds and the common cold. Avoid pungent, greasy, and gas-causing foods. Keep your living environment clean and eliminate or avoid factors that might affect the respiratory tract, such as smoke and dust. For massage, you use your thumb to press knead the point lung 5 for 3 minutes until distension is produced once daily. The lung 5 point is ideal for treating lung diseases because it has the function of replenishing the lung qi and nourishing the lung yin. Thank you so much for your attention.
Interviewing. Case history 2 and 3 on migraine. A 50-year-old woman had been suffering from headaches since she was 18 years old. The headaches occurred mostly on the right temple area, were of a throbbing character and were accompanied by blurred vision. The headaches were better during pregnancy and worse from taking hormone replacement therapy. She also suffered from insomnia and constipation. Her periods had recently become irregular, and the menstrual blood had dark clots. Her cheeks were red, and her eyes lacked sparkle and looked nervous. Her tongue was red and slightly purple, redder on the sides, and did not have enough coating. Her pulse was fine and slightly rapid. Diagnosis. The headaches are clearly due to the rising of liver yang, indicated by their throbbing character, the location on the temple, the blurred vision, the red cheeks, and the insomnia. In this case, liver yang rises from a deficiency of liver yin, which is manifested by the lack of coating on the tongue, the constipation, and the blurred vision. The amelioration during the pregnancies and aggravation from taking HRT, in this case, indicate a liver disharmony. The slightly purple color of the tongue indicates a tendency to blood stasis, of which the dark menstrual clots were the only symptoms. Next, case history 3. A 36-year-old man complained of migraines since the age of 11. The attacks came every few months, affecting either side of the head along the gallbladder channel. The pain was sharp and throbbing and was often accompanied by vomiting and blurred vision. In between the severe attacks, he occasionally suffered from a dull occipital headache. He also suffered from high blood pressure, for which he took medication, which, however, did not control it well. He also complained of a dry mouth, and the interrogation did not reveal any kidney symptoms. He was overweight, and his complexion was dull pale with a greasy skin and several small pale moles on the face. His eyes were very dull and lacking of luster. His tongue was dark red with a redder tip, swollen and with a rootless white coating that looked like salt. Although he was on the beta blockers, which alter the pulse significantly, making it deep and slow, his pulse was very weak on both rear positions. Diagnosis on this case: the headaches are clearly due to liver yang rising, which is evidenced by the severity and throbbing nature of the pain. Vomiting and blurred vision. In this case, the origin of liver yang rising is in liver and kidney yin deficiency. This is apparent from the tongue, which shows a severe yin deficiency with empty heat. It is unusual but not infrequent that there are no other symptoms of kidney deficiency, and the dry mouth is the only symptom of yin deficiency. Exactly the same pathology that is causing the headaches is also at the root of the hypertension. His complexion and body shape contradict the above patterns because the complexion is dull pale, while it should be red or floating red, and the body shape is overweight, while yin deficiency usually causes a person to be thin. This is due to the presence of phlegm, of which he has no other symptoms. However, certain signs show the presence of phlegm. These are the swelling of the tongue, the dull pale complexion, the greasy skin with small pale moles, and the overweight body shape. The lack of shen of the eyes indicates severe emotional problems, which he confirmed having, which may also be causing the complexion to be dull and pale, contradicting the tongue. Thank you for your attention.
Let us now go to auricular acupuncture. The topic is anatomy, mapping, and nomenclature of auricular points. The ear is mostly composed of cartilage and connective tissue with a minimal amount of adipose tissue, but is supplied with numerous nerves near the skin surface. It is thus often more painful to have needles inserted into auricular points in the ear than into the body. The ear contains many parts: the helix, apex, and the helices, which are the tubercle, cauda, crus, and notch, the antihelix, including the principal, superior, and inferior parts, the triangular fossa, scapha, tragus, supratragus notch, antitragus, intertragus notch, concha, cymboconcha, cavum concha, orifice of the external auditory meatus, and earlobe. Here we can see in figure 8.4 the anatomy of auricular surface. Unlike body acupuncture points, the auricular points were named according to the corresponding parts of the organ or body system, that is, the lung, heart, stomach, endocrine, etc. The auricular points are distributed as an upside down fetus. The earlobe is related to the head and face region. Upper extremities are in the scapha region, the lower extremities are in the superior antihelix crus region, and the internal organs are located in the cavum and cymboconcha areas. Here we can see in figure 8.5 the mapping of the auricular points. And here is a more detailed corresponding organ and system of the auricular points and the back view of the auricle. Thank you so much for your attention.
Let's discuss differential diagnosis, Western and Chinese medicine. The hypertension. First, the primary hypertension, largely asymptomatic. Lifestyle factors may contribute. First, the smoking, letter B, family history of hypertension, obesity, excessive alcohol consumption, especially binge drinking, lack of exercise, a diet high in animal fats and sodium chloride, lead, lead and cadmium contamination. Number two, secondary hypertension. Symptoms may include headache, particularly on waking, tinnitus, dizziness, confusion, papilloedema, facial flushing, fatigue, epistaxis, nervousness. Hypertension may be secondary to the following diseases: kidney disease, endocrine disease, narrowing of the aorta, steroid medicines, the contraceptive pill, pregnancy, which can cause preeclampsia. Number three, the risk factors. Hypertension carries with it an increased risk of major illness, including cardiovascular disease such as angina, stroke, heart attack, or atrial fibrillation. Kidney damage, damaged site. Chinese differentiation, hypertension, the diagnostic questioning according to First, headache, head distension, dizziness, palpitation, insomnia, numbness, tingling. Number two, the tongue and pulse. There is a red tongue tip, edges, yellow fur, wiry pulse, hyperactive liver young, pale tongue, red tips or sides, slimy yellow fur, wiry, slippery, rapid pulse, phlegm, heat harassing the heart, red tender tongue, scanty or no fur, fine rapid pulse, liver, kidney yin deficiency, pale red tongue, scanty fur, wiry, fine pulse, Jong-Ren disharmony, dark purplish tongue, possible static macules, spots, wiry chappy pus, blood stasis, thick white slimy tongue fur, wiry slippery pulse, phlegm obstructing middle burner, fat, pale tongue, teeth marks, scanty no fur, fine purseless, possible rapid pulse, chi and yin deficiency, pale tender tongue, red tip swollen, red papillae on root, deep, slow, forceless, floating, surging, or fine rapid pulse, yin or yang deficiency. Number three is dizziness with head distension or pain, vertigo, insomnia, hyperactive liver yang with head distension, palpitation in the heart, with tinnitus, insomnia, palpitations, numb extremities, yin deficiency. Perimenopausal with headache, insomnia, worse with exertion, that is deficiency, with tinnitus, yin and yang deficiency. Number four, Sangfu patterns. For the excess, there is a hyperactive liver yang, liver fire generating wind, liver wind harboring phlegm, stagnation of liver qi turning into heat, blood stasis, phlegm obstructing the middle burner. For the deficiency, there is blood deficiency, liver kidney yin deficiency, Jong and red disharmony, Qi and yin deficiency, kidney yin and yang deficiency. Thank you for your attention.
Let's proceed to relationships among Zhang viscera, and let's talk about the relationship between the liver and the kidney. The relationship between the liver and the kidney is demonstrated mainly in two aspects. The fact that essence and blood share a common source, and the mutual nourishment of liver yin and kidney yin. The liver stores blood and the kidney stores essence. Essence can generate blood, and blood can transform into essence. Liver blood depends upon kidney essence for nourishment. If kidney essence is abundant, then liver blood is ample. Kidney essence depends upon liver blood for nourishment. If liver blood is ample, then kidney essence is abundant. Liver blood and kidney essence both derive from the essential substances extracted from food and drink. Thus, essence and blood share a common source, and similarly, the liver and the kidneys share a common source. Deficiency of kidney essence can lead to deficiency of liver blood, and vice versa. In either case, eventually both liver and kidney become deficient. This is manifested as emaciation and lumbar and knee aches and weakness. In males, there may be impotence. In females, there may be diminished or absent menses. Here is an illustration showing the relationship between the liver and the kidney. The liver stores blood, which transforms into essence. Kidney stores essence, which produces blood. Now let's go to the mutual nourishment of liver yin and kidney yin. The kidney stores essence and belongs to the water element. Kidney yin nourishes the liver yin and prevents excessive activity of liver yang. Liver yin also nourishes kidney yin. Insufficiency of kidney yin can lead to deficiency of liver yin, which in turn give rise to excessive liver yang. Injury to liver yin can induce injury to kidney yin, causing deficiency of kidney yin. Both conditions can eventually lead to deficiency of yin and excess of yang. Clinically, this is seen as dizziness, fainting, tinnitus, agitation and irascibility, lumbar and knee aches and weakness, and feverishness in the five centers. In males, there is nocturnal seminal emission, and in females, reduced menses. Thank you for your attention.
Diagnosis according to Zhangfu organ patterns, we discuss kidney insufficiency. Kidney insufficiency is a weakening of yin at the deepest level. It could be caused by a chronic condition of yin deficiency in another organ or by the long-term overstraining of the body, mind, or psyche. Because kidney yin is such a deep and a fundamental aspect of the body, the imbalance will usually have built up gradually over time. Furthermore, because it is such a deep and fundamental deficiency, and because kidney yin also relates to Jing, the treatment of this imbalance will also take longer than other imbalances that have a more superficial nature. Long-term physical, emotional, and mental overexertion, chronic stress, prolonged illness, working at night, using medications that are hot or spicy in their energy, excessive sex, a diet that includes an excess of food or drinks that are hot or spicy, too much coffee and other stimulants, congenital weakness, and old age can all weaken yin. Kidney insufficiency will often occur as a consequence of chronic imbalances in the body. For example, a chronic blood deficiency condition will weaken yin. Similarly, prolonged or intense fire conditions and febrile diseases can injure the fluids and thereby kidney yin. Kidney yin is the root of all yin in the body. When kidney yin is weakened, yin deficiency conditions in other organs can also arise. Symptoms and signs include insomnia, dry mucous membranes, dry skin, dry mouth and throat, night sweats, poor memory, nocturnal emissions, premature ejaculation, infertility, tinnitus, poor hearing or deafness, dry eyes, weak or sore knees, lumbar weakness or soreness, thin or slender body, sparse and dark urine, dry stool or constipation, mild feeling of anxiety, depression, dizziness, thin, dry tongue that lacks coating and possibly has cracks in the surface of the tongue, fine or empty pulse. Pulse may be relatively weak in the sure positions. Key symptoms are night sweats, sore lower back, and absent tongue coating. Treatment principle, nourish kidney yin. Acupuncture points we can choose from bladder 23 and 52, Ren 4, spleen 6, kidney 3, 6, and lung 7. Needle technique is tonifying. Bladder 23, 52, Ren 4, kidney 3, and spleen 6 nourish kidney yin. Lung 7 and kidney 6 in combination open the Renmai and Yin Chao Mai and thereby nourish kidney yin. It is essential that a person who is kidney yin deficient gets enough rest and relaxation. This means that they must get ample sleep and go to bed early at night. They must not work too hard. Neither should they spend too much time watching television and or staring at a computer screen. They should avoid stimulants such as coffee, as this will stress their system. Alcohol is not good either because it is both spreading and hot in its energy. Sweating too much will mean that they lose body fluid. Therefore, a person who is kidney deficient should avoid saunas or steam baths. Men in particular should limit how much sex they have, including masturbation, because Jing is lost when ejaculating. Shiatsu, massage, and meditation are beneficial because they promote calmness and tranquility in the body and mind, thereby nourishing yin. Dynamic activities such as aerobics or action sports are not beneficial and should be discouraged because they will further consume the person's yin. Lighter and more meditative activities such as qigong, yoga, and tai chi nourish yin whilst activating the qi. Dietary advice includes avoiding food and beverages that are stimulating or hot in their dynamic. This includes coffee, black, green, and white tea, alcohol, sugar, and hot spices like chili and garlic. The way food is prepared will affect its dynamic. Baked food, as well as being more warming in its dynamic, will be dynamically drier. The consumption of baked food should therefore be limited when there is a yin deficiency condition. Soups, stews, and boiled vegetables, on the other hand, should be recommended. Concentrated proteins, green leafy vegetables, cereals, and root vegetables nourish in general, as do things that are rich in minerals such as seaweed. Oil and products that have a high oil content, for example, nuts and seeds, will nourish and moisten yin. Foods that specifically nourish kidney yin include alfalfa sprouts, asparagus, potatoes, green beans, nettles, aduki beans, black beans, kidney beans, coconut milk, sesame seeds, walnuts, octopus, oysters, duck kidneys, pork, and egg yolks. Kidney insufficiency can be caused by liver insufficiency, heart insufficiency, lung insufficiency, stomach insufficiency, liver blood deficiency, kidney yang deficiency, fire, heat, blood deficiency. And this can result in empty heat or deficiency heat, liver yin deficiency, heart yin deficiency, lung yin deficiency, stomach yin deficiency, liver blood deficiency, kidney yang deficiency, kidney jing deficiency, phlegm, and blood stagnation. So to summarize, the etiology of kidney yin deficiency would include long chronic illness, overwork over long period, excessive sexual activity, depletion of body fluids, blood loss. Underlying or accompanying pathology would include kidney essence deficiency, heart, liver, or lung insufficiency. Signs and symptoms: dizziness, tinnitus, vertigo, poor memory, night sweating, dry mouth and throat at night, lower back ache, ache in bones, bleeding gums, hardness of hearing, nocturnal emissions, constipation, scanty dark urine, infertility, premature ejaculation, tiredness, lassitude, depression, slight anxiety. Pulse, floating, empty, tongue, normal color, without coating. Treatment principle, enrich kidney yin. Acupuncture treatment, bladder 23, REN 4, kidney 3, bladder 52, kidney 6, kidney 1, spleen 6, lung 7, with kidney 6, will open the directing vessel, which is called the Sea of Yin, needle with supplementation. We select further points according to symptom. If there is dizziness, we would add DO20, DO16, and GB39. If there is tinnitus, we would add SJ17, GB2, SJ3. For dry pharynx and mouth, use kidney 2 and Sanjiao 2. Tidal heat, kidney 2, heart 8, lung 10, P5. For lumbar pain, DO3, bladder 40, bladder 60. Seminal emission, kidney 12, REN 6, heart 7, stomach 36. And if there are night sweats, we add SI3 and heart 6. Thank you for listening.
Pathogenesis, transmission of illnesses. The up and down transmission. External evils are of different natures. They often attack the body at different sites, some in the upper body and some in the lower body, and enter different routes. Because the human body is an organic whole, though the sites of attack may be different, the pathogenic evils can, by means of the meridians, transmit up or down. The plain questions state, Yang illnesses tend to move upwards until reaching the top, then turn around and move downward. Yin illnesses tend to move downward until reaching the bottom, then turn around and move upward. Hence, in illnesses of wind, the upper body is affected first, and in illnesses of dampness, the lower body is affected first. Transmission by the Sanjiao is one of up-down transmission by means of the upper, the middle, and the lower jiao. For example, exogenous heat illnesses, especially those of heat dampness, generally transmit sequentially from the upper jaw to the middle jaw to the lower jaw. So the transmission among Zangfu viscera. The body is an organic whole, and the Zangfu viscera are its most important organ systems. The principal modes of transmission here are those of Zang to Zang, between a Zang organ and its dyadic Fu organ by exterior-interior transmission, and from Fu to Fu. So let's talk about Zang to Zang transmission. This kind of transmission is from one Zang organ to another. The sequence of such transmissions is determined by the theory of the 5 elements. Transmission by over-restraining or counter-restraining. Transmission of illnesses from the heart to the lung, from the lung to the liver to the spleen, from the spleen to the kidney, and from the kidney to the heart. These are all of this kind. In each case, the transmission reflects the worsening of patient's condition. The most common of these situations is rage damaging the liver and inducing diarrhea, known as liver wood over restraining spleen earth. Now, transmission between mother and son. This is transmission through relationship of generation between two elements. If the mother organ is ill, the illness of the mother organ will be passed to the son organ. For example, consider the liver and the kidney. Deficient kidney yin cannot moisten liver wood. Therefore, deficiency of kidney yin leads to liver yin deficiency. This is also the situation in which the son steals the mother's qi. Thus, deficiency of liver yin can induce insufficiency of kidney yin. In general, transmission from the son to the mother represents a more severe illness than transmission from the mother to the son. Now let's talk about Zhang to Fu transmission. This situation usually takes place between a Zhang organ and its dyadic Fu organ. For example, the heart and the small intestine form a Zhang Fu dyad. Heart fire can pass to the small intestine along the meridian. The spleen and the stomach form a dyad. Spleen deficiency can induce stomach dysfunction. The lung and the large intestine form a dyad. Impairment of the lungs, dispersion, and depuration functions can disturb the functions of the large intestine. The kidney and the urinary bladder form a dyad. Impairment of the qi forming function of the kidney can cause difficulty with urination by the bladder. And last, Fu-to-Fu transmission. Though each of the 6 Fu organs has its own unique functions, they all participate in the metabolism of food and water intake, decomposition, assimilation, transformation, distribution, and discharge. And from beginning to end, they maintain a dynamic fluctuation between fullness and emptiness. Thus, a disturbance in any one of them can affect the others. For example, blockage of the qi of the large intestine by impairment of its conveyance function can cause abnormal upward flow of stomach qi. This is manifested as hiccup, nausea, and vomiting. If dampness and heat accumulate in the stomach, the gallbladder is steamed and bile can flow outward abnormally, producing bitterness in the mouth and jaundice. Thank you for your attention.
Let's discuss the pericardium in mental emotional problems. In the context of mental emotional problems, it is important to explore the nature of the pericardium, how it relates to the minister fire, and what connections, if any, there is between this minister fire in a 5-element context and the minister fire of the kidneys. The simple questions in chapter 8 says, the pericardium is the ambassador, and from it joy and happiness derive. Like the heart, the pericardium houses the mind, and it therefore influences our mental emotional state deeply. For example, a deficiency of blood will affect the pericardium as well as the heart, making the person depressed and slightly anxious. Heat in the blood will agitate the pericardium and make the person agitated and restless. Phlegm obstructing the pericardium will also obstruct the mind, causing mental confusion. The pericardium's function on the mental emotional plane could be seen as the psychic equivalent of its physical functioning of moving qi and blood in the chest, just as it does that on a physical level, on a mental emotional level of the pericardium is responsible for movement towards others as in relationships. So we have here the illustration of moving action of the pericardium. The pericardium moves qi of heart and lungs in the chest, that is on the physical level, mental, emotional level. So we have here the points of Bren 17, 15, and 14. Given the pericardium is related to the liver within the terminal yin channel, this movement is also related to the movement of the ethereal soul from the ego towards others in social relationships and familial interactions. For this reason, on a mental emotional level of the pericardium is particularly responsible for a healthy interaction with other people in social, love, and family relationships. The unique place that the pericardium occupies in the pathology and treatment of mental emotional problems is partly due to its partaking of fire, as it is the minister fire that assists the emperor fire of the heart and of wood with the liver within the terminal yin. Partaking of wood in the ethereal soul, it gives the mind movement towards the others, that is, it plays an important role in relationships. On a physical level, the pericardium moves qi and blood in the chest. So the heart, which is the emperor fire, the pericardium, the minister fire, goes down, which is the terminal yin, liver, wood, ethereal soul. Moreover, the moving nature of the pericardium is also enhanced by its relationship with the triple burner as a channel within the minister fire channels, as the triple burner is responsible for the free flow of qi together with the liver. The pericardium's relationship with the triple burner accounts for its action on moving qi and blood and its mental emotional function of movement towards others. So we have here the pericardium at the center. It goes up with the minister fire with triple burner and goes down minister fire, the kidneys. Thank you for your attention.